Hi, Dr. Muhammad. Nice to meet you.
Hello, Kayla. Nice to meet you too.
So I'm Dr. Kayla, and what is the patient's name?
The patient's name is Maimuna.
Hi,
Zan
nice to
fa-
meet you.
Tana gaishe ki dan daga mata hannu. So she's saying hi to.
Hi. So what brought you into the hospital today?
Okay, so me ke damun ki, me da me ke damun ki. Hmm. Okay, she said she's having fever, headache, and vomiting.
Okay.
Yeah.
How long have you had your fever for? When did it start?
Okay, wannan ciwon kan yaushe ne ya fara? Okay, she said the fever started this morning.
This morning? Okay.
Yeah.
So has it just gotten worse throughout the day, or has it gotten better at all?
Yana ɗan ƙaruwa ne ko ya zo ya tafi ne? Okay, she said the fever just comes and go.
It
It's
comes
on
and
and
goes.
off. Yeah.
Okay. And you also said, did you say you were vomiting?
Yeah. She's vomiting.
Okay. Do you have any dizziness? So you're nauseous. Do you have any dizziness, fatigue, anything like that?
Kina jin jiri ne ko mutuwan jiki? Okay, she says she doesn't have dizziness, no fatigue.
Okay.
Yeah.
So I'm going to, doctor, I'm going to treat or test the patient for malaria using a rapid diagnostic test, just because her fever breaks, and that is a big sign of malaria. So we can run a
Okay.
rapid diagnostic test.
Okay,
And
that's
then,
correct. That's good.
yes, and then I would also like to test her temperature to see the severity of her fever. And then because some people get anemia after malaria, I'd like to do a blood sample and test her hemoglobin levels to see if she has a low level of hemoglobin, because that could be a sign of anemia. And she has vomiting, so I'm not sure if she's getting anemia, but I would just like to test anemia to rule that out.
Yeah, that's very good. The investigations you ordered, you did well. The rapid diagnostic test for malaria for this patient came out to be positive for malaria. Her
Mm-hmm.
hemoglobin level is within the normal limits, and you also said you're going to check for about what other investigation did you say you were gonna order?
Can I test the temperature of the patient?
Yes, the temperature of this patient is 37.9 degrees Celsius.
37.9 degrees Celsius.
Yeah,
Okay, thank you.
you're
Um,
welcome.
so she tested positive for malaria, but she has normal levels of hemoglobin, which is good.
Yeah.
So, and then it also looks like she has uncomplicated malaria, just because she isn't having any symptoms of complicated malaria.
Yeah.
So to treat that, I would treat that with ACT therapy.
Okay.
And then moving forward, I would suggest that she wears like long shirts and long trousers, just to protect her, protect and make sure that she isn't exposed, like none of her skin is exposed to possible
Okay.
mosquito bites. I
Wow.
would also suggest that she gets a nest, or what is a
Mosquito nets.
yes, that.
Yeah.
Um, just to protect from any mosquitoes. And then also, if she would like, she could get mosquito repellent, and that
Okay.
can help keep mosquitoes away. And yeah, that should.
Yeah, that's great. You did great, Kayla.
Thank you. Thank
You were
you.
able to diagnose malaria from the symptoms of this patient. He's having fever, headache, and she's vomiting. Symptoms of malaria. You thought of
Mhm.
malaria. That's good of you. You did the investigations you ordered. You did
Thank you.
great. You ordered for RDT, which we did here, and it was positive for malaria.
Mhm.
It's good that you also try to rule out anemia, because patients that actually present with malaria can come down with anemia, even though this
Mhm.
patient does not have it, but it's very good. You did great by mentioning that. And
Mhm.
temperature also, you did great for examining the patients. And another good thing you did is you suggested SCT-based combination for this patient because she's having uncomplicated malaria, so we cannot go for the parenteral treatment. You did
Mhm.
well, and you suggested means of prevention, which is very good. You did very great, Kayla.
Thank you.
Congratulations.
Thank
You're
you.
welcome.
Thank you,
Yeah,
doctor,
you're
for
welcome.
helping me. And I hope
You're welcome.
you get well soon.
Yeah, she helped well. She helps so too, and she's saying she's grateful for what you people have done to her.
Thank you. Of course.
Yeah, so again.